Peak Orthopedics has been a group since 2006. We've really focused on cutting-edge techniques over the years with hip and knee replacement. We've spent a lot of time and additional training honing our skills, in particular the anterior approach for hip replacement, and that's really driven our practice and our growth.
Our mission is really to provide the best service to the patients. We use the latest techniques based on sound scientific principles, and we were really trying to get the best results through the better techniques. We're looking a lot towards minimally invasive options, restoring anatomy, and this is really leading us to fantastic results.
So at Peak Orthopedics and Spine, we have a comprehensive approach to musculoskeletal problems, and we like to evaluate some of the newer technologies to see if they fit with that approach, and recognizing that relying on our experience is important when evaluating the new technologies, so that we're not just always implementing the newest thing because it's new, but rather because it's better for the patient.
I get to take care of a certain part, but the practice itself gets to take care of the whole person. And it's very comforting to know that even though I do elbows, wrists, and hands, that if someone's got a shoulder problem or a neck problem, I can just say, hey, just go see someone within this office that I know will provide a comprehensive, very thorough and complete care for the patient.
Quite honestly, when Dr. Greenhow and I started 8 years ago, we never thought we would grow into a multi-office, multiple surgical center practice where we have essentially cast a huge net over the city and build a group of surgeons with multidisciplinary talents. The advantage of that in an orthopedic group is we feel that we can really address patients' musculoskeletal complaints from head to toe.
I think one of the advantages of our group is we take a very holistic but also very conservative approach. When someone comes in through the door, we don't immediately book them for a surgery. We start with very simple things such as physical therapy, anti-inflammatory medications, injections, and when all of those things have failed, then we start talking surgical options. And I think that's where we really shine as a group. We have guys who are very specialized in their training, from our spine surgeon who does everything from fusions to disc replacements, to our shoulder surgeon who uses the latest and greatest arthroscopic techniques, to our joint replacement surgeons, Dr. Laux and I, who use cutting-edge techniques, anterior approach muscle-sparing joint replacement for hips.
With the addition of Dr. Yi for hand surgery, we really can cover all aspects of your musculoskeletal problems. And so the goal of the group is to be able to function together to deal with a specific problem related to your body that may or may not be related to a spinal problem or an extremity problem, so that we don't have to have you moving from practice to practice. You can stay within one practice.